Today, we're going to discuss a very important topic of toxicology, in which we have the group of poisons which are known as inebriant poisons. So, classically, this group of poisons, which are known as the inebriant poisons, they have the symptoms which reduce pain, and this is the classical action of inebriant poisons. And due to this reduction of pain, there is an induction of sleep that is induced in the individuals who have taken the amount of these inebriant poisons in significant amounts. And obviously, we must know whenever we are discussing or whenever we are going through this subject of toxicology, we must know that we have the concerns regarding the fatal doses and regarding the fatal periods. Because as we all know, we are discussing the forensic toxicology, so we would not be discussing the therapeutic uses of this inebriant group of poisons. Rather than, we would be considering the doses in which these group of chemicals can basically produce fatality in the individuals. What are the exact amount of doses, the exact fatal doses regarding this group? And obviously, whenever they're administered, we're also concerned with the fatal period of these groups. So this is all about the subject of forensic toxicology. That it basically includes discussions regarding the different groups of poisons that we're going to go through. And it's again very interesting to go through the classical sign and symptoms and clinical features that are included for a particular group that we're going to discuss over here. So we all know that basically we have these group of poisons in which it is going to act upon the central nervous system. So we have already discussed a group of poisons which are going to act upon the spinal cord. So it's again very important that we know that there are centers for coordination that are present in the central nervous system. So if we have a group of poisons which is going to affect the central nervous system, in return, the classical clinical picture would also include a disturbance and alteration in the coordination of that particular individual. There is a stage of excitement that is included. There is a state of elation that is present. So after that, there is this stage of incoordination. That is the second stage. And then after that, we have a stage of necrosis. If the amount is significant enough that it is basically signifying an acute poisoning with the alcohol, the person can literally go into this stage of narcosis, and obviously it can cause the death of that individual. So the major categories that are included over here are the ethyl alcohol, and then we have the methyl alcohol. The doses are again quite different for both of them, and the antidotes are again very different. So we must know that how you basically classically go through the chemical composition of these compounds, what are the significant stages in the clinical features, because that is going to highlight the factor that what kind of doses were taken by that particular individual. What is the medico-legal significance to this study that we're going to go through today? Usually, the negligent drivers, negligence in the road traffic accidents, we usually come across when we are practicing as the forensic practitioners. So it's very important to conclude at that point whether the driver was in some kind of an intoxicated state or not. Specifically, there are a lot of times that people drive after the consumption of alcohol, and which is basically against the law. It's illegal. And again, just to highlight these factors, we must know how to diagnose people who have taken or who have consumed alcohol in any form. Because addiction is obviously associated with these factors, but we're again going to consider that whether a person was driving or not after the consumption of alcohol or not, because usually in all of the countries we have this against the rules or against the law of that particular country. And that can basically result in the negligent road traffic accidents that we usually come across. So we have a lot of tests diagnostic tests available out there. Specifically, we have the breath tests, and obviously blood samples can be taken at that particular time, and they can be sent to the histopathologist for further evaluation, and just to look for the factors that whether this particular driver was having, or he may have consumed alcohol before driving or not, or is he intoxicated with any other kind of drugs or not. So this is why it is more important medico-legally, because you can have these cases of this particular negligence that you can encounter. Then we have the homicidal encounters, we have the suicidal encounters, of course. Usually people go into a phase of depression after the consumption of alcohol. And there is a phenomenon of automatism that is again associated with this alcohol consumption, because it is quite significant in the reduction of pain, and it gives you a feeling of relaxation. People usually consume it in amounts, they get used to it, and usually you would come across the cases of chronic alcohol poisoning rather than the acute sort of alcohol poisoning. But obviously, in children, for instance, children, in the negligent cases, we usually come across children taking or consuming these alcohol in small amounts. They're given by their caretakers or by the people who are taking care of that particular child, and usually they are found to be, they can be found to have fatalities in that particular case. So these can be the particular scenarios. We can come across the cases of homicidal acute alcohol poisoning, or the chronic alcohol poisoning that we can come across, and we must know how to diagnose these cases, how to take the blood samples, and obviously what is the required protocol for investigation in these particular cases that we're going to go through. Then the characterization of these particular poisons, as we were already going through the sign and symptoms and the clinical features, because for diagnosis, we must know how to go through these particular cases. First of all, there is a stage of excitement. Now, in this stage of excitement, that can be noted down by the verbal commands, as well as if there are delusions of grandiosity that the person is characteristically suffering from, then obviously it can be marked as the stage of excitement in these particular individuals. Then, moreover, we have a set of signs and symptoms which are characterized by the stage of narcosis. Now, in this particular stage, in between this particular stage of symptoms, we have the stage of incoordination also inculcated in between. The person is unable to perform. The gait is again very evident, and you can even diagnose through the gait of that particular individual that this particular person is intoxicated with alcohol in this particular stage. A simple test, for instance, the finger nose test to check the coordination of the individual is very important. And then again, being conscious in time, space, and person is again very important. This is basically to check the orientation of that particular individual whom you're testing. Then moving on, we have the stage of narcosis. So in this particular stage of narcosis, we're going to check for the Glasgow Coma scale. This scale is this scale is performed for the evaluation of the conscious level in this particular individual. And then obviously we have other particular signs and other particular clinical features regarding this stage of narcosis. And specifically, we have the diminished reflexes. That is one of the particular features. We have the pinpoint pupils. So the examination, the inspection of this particular patient is very important. You move on through the palpation, percussion, and basically auscultate the individual as well, and perform the complete examination in these individuals to evaluate the stage. Why is this important? Because if the particular individual is entering or is nearby the stage of narcosis, is basically exhibiting the signs of the stage of narcosis, he or she needs to be resuscitated in no time. The airway, breathing, and circulation may be stabilized in these particular individuals. So for this management, and just to have a prophylactic management also in these particular cases, we must know how to evaluate and how to perform different tests for these particular patients. Now, the examples and how do we basically classify this group of inebriant poisons, we have most specifically, we have ethyl alcohol. As we all know by the definition of poisons is that almost anything can prove to be a poison if it is given in doses which can prove fatality and within that particular, after giving or after administering these particular doses through that particular route of administration, you have that certain fatal period during which the death of the individual can even occur in particular cases. And again, it is also going to depend upon a lot of factors: the age, the sex of the individual, if there are any predisposing conditions, if there are any debilitating diseases or conditions that the person has. There is a role of environment also over here. So all of these are the particular perpetuating factors over here, and we have to even consider them, and we have to even take them in account over here. So ethyl alcohol has its particular therapeutic uses as well. It can be used in the laboratories. So that is why we might come across cases of accidental poisoning with these drugs as well. So this is one of the aspects to look at in cases of ethyl alcohol poisoning. In this group, we have the methyl alcohol included. We have the isopropyl alcohol, which is also included in this particular group. And then we have the ethylene glycol, which is one of the major drugs as well. Then ethanol is also considered over here, and it is also known as an absolute alcohol. 99% ethanol is basically known as an absolute alcohol. So then we have the rectified spirit, which is basically a combination of ethanol with distilled water, and it's almost 95% ethanol. Then we have methylated spirit. Now, depending upon the uses, basically these mixtures are formed. They are used in the laboratories, they're used as disinfectants, and due to these particular different lab uses and different industrial uses, different therapeutic uses, there are different mixtures, there are different tinctures that can be made or that can be prepared to the same chemical compound, which is known as ethyl alcohol. We have the methylated spirit, which is basically a mixture of ethanol and methanol over here. Then we have the surgical spirit. So a lot of surgeries in which we use it as a topical disinfectant, in which basically it is a methylated spirit, and it is a combination of this methylated spirit which we already discussed. It's again in return a combination of ethanol and methanol, and then basically this mixture is again tinctured with castor oil and the oil of wintergreen. These are all the chemical compounds that are being used, and they give a specific color to the surgical spirit that we have already seen, that we usually come across in the surgeries. The proof spirit is basically a mixture of absolute alcohol, almost 57.10% and by volume, and almost 49.28% by weight. So this is the correct description for the proof spirit over here. So these have all of these ethanol compounds. They have their different uses, either used surgically, either used topically, or either used in the labs for the different chemical tests that can be performed with them. So depending upon that, we are making these mixtures and consuming them in that particular case. Arrack is one of the compounds. It's basically a liquor which is made from cocoa palm and rice. So as I've already discussed, basically it is a drug of addiction as well. People get addicted to take this kind of a drug. And arrack is one of the combinations which is quite notorious, and a lot of people get addicted to this kind of compound over here. So these are some of the examples of ethanol or ethyl alcohol, and some of also describing some of the uses over here, how we can use this alcohol compounds, and how can they be beneficial for us in a lot of situations. Now, as we discuss and as we go through any of the poisons, we must know how is it metabolized. This is important. This has its significance because again, when we want to diagnose these cases, we'd be sending the histopaths of different organs. And we would be basically curious to know whether the histopath revealed any sort of this poison or not. Knowing the organs in which these poisons are metabolized is going to make the situation more easy for us as a forensic practitioner. So the metabolization, how is it absorbed, and after the absorption from the GIT, what is the fate of these poisons? It is very important. And what percentage of metabolism takes place in that particular organ? So the fate of ethyl alcohol would be almost 90%, it's almost oxidized in the liver. And then after that, almost 10% is excreted in the urine and breath. So this is, again, this is very important because as I was already mentioning the fact that we have a breath test, which is a very quick way to diagnose whether the person is intoxicated or not. For instance, we have these quite portable kind of instruments that are used and in which the person is asked to exhale, and that can even detect the slightest amount of alcohol if it is consumed by the driver. So this is a kind of a breath test that we usually perform. And that is how basically we know almost 10% is excreted in the urine and breath, and it can be basically evaluated over here. We can send the urine samples as well, just to be on the safer side. We can perform the breath tests as well. And we must know that almost 90% is oxidized in the liver. So the post-mortem appearances and sending the liver tissue for the histopathology is very important to detect whether the person was consuming alcohol for a chronic period of time, whether he was an alcoholic, whether he was an addict with alcohol or not. So this is going to be mentioned over here. Alcohol level reaches its maximum after absorption, almost in 40 to 90 minutes. It is absorbed and it can be detected in the blood. So we already discussed that we are basically going through the acute alcohol poisoning right now. We're not discussing the addictions right now. We're not discussing the chronic poisoning. The acute poisoning would have the particular typical stages that we already discussed. And the major aim or the major motto as a practitioner would be, as a general practitioner would be, if you come across these cases in your emergency departments and you have already diagnosed that this person has taken alcohol in a very large amount in the fatal doses, and now we have this particular fatal period in which we have to work and manage this case. So it's again very important to evaluate these cases in a particular manner just to know that what is the stage that they are suffering from, and accordingly we have to manage these cases as well. Now, basically, the stages of acute alcohol poisoning, as we've already discussed, we have the three major stages out here. First of all, we have the stage of excitement, which is also marked with these particular signs and symptoms of elation in this particular period. Then we have a stage of incoordination, as we can even see over here, and then moving on, we have the stage of narcosis, which is basically characterized by the unconsciousness, which is again coupled up with the particular features of pinpoint pupil, diminished reflexes in these individuals. The stage of incoordination is very important, just to observe the gait of the individual, just to observe the conscious level of the individual. Is he well oriented in time, space, and person is very important over here. You ask the person why he came up here, what is the date, what is the day, and if he's coordinated, if he's well aware of all of the situation, then again it's very important. That is basically going to highlight the factor whether he's in the stage of incoordination or not. Accordingly, we're going to manage these cases in this particular scenario. So we have the stage of excitement, and it is going to be seen in cases in which the blood levels which would reach almost 30 to 100 milligrams, that is the percentage in the blood levels, the concentration of alcohol in the blood. That is basically going to depress the higher centers. The higher centers are basically the centers which are used for the orientation, and usually the person is in a stage of grandiosity, in this stage of excitement. The talk is going to be evaluated, the flight of ideas is going to be seen in such patients who are suffering from stage of excitement. Again, the speech is also considered and evaluated for these patients. Then we have the symptoms over here in this stage of excitement. We have the feeling of pleasure, which is also associated with an increased self-confidence in these individuals. We have an increased laughing phenomena seen. They are more talkative than normal, and there is an increased form of rage and anger that is also observed in these cases. And then there are the features seen. For instance, we have the disclosure of secrets. So these are some of the symptoms that would be observed if a person is in the stage of excitement in this particular case. Then moving on, we have the stage of incoordination. There would be imbalance and incoordination that is observed for these individuals. The symptoms over here would include the particular symptoms would be the depression of motor centers, and then there would be confusion in the thoughts. There would be a flight of ideas, there would be a flight of speech, and that is again going to be evaluated in the individuals when you're going to inculcate or evaluate the thoughts of these individuals. There is a rather confusional state seen for these individuals. There is a slurred speech phenomena. Staggering gait or an imbalance in the gait is also noted down. Then there are a lot of accidents that can occur at this stage. So this stage is marked with a lot of accidents, with a lot of crime that can take place in this stage of incoordination. We have cases of assaults, we have cases of rape, and we have cases of negligent road traffic accidents that can occur in this stage of incoordination in the individuals. So this is medico-legally very important. This is a stage which is very important to you if you're practicing forensic and you're evaluating an individual. This is a stage in which an individual can commit a lot of crime. Violence and rage is one of the key feature over here. Sexual offenses, rape, as I've already said, this is one of the factor that has to be considered, and it usually occurs in the stage of incoordination. And then obviously it is marked with a lot of crimes, with a lot of assaults that can take place at this place. So a person can get himself or herself in trouble if he has consumed alcohol and has passed on into this stage of incoordination. Now, the stage of narcosis is again usually seen in individuals in which the blood samples would reveal the percentages that are higher than 300 milligrams. So this is the usual percentage. The depression of the vital centers in the medulla is one of the mechanism of action that takes place and leads to all of the sets of signs and symptoms that are seen in this stage of narcosis. The symptoms over here would again include a deep sleep. So that is going to mimic unconsciousness, and deep coma, deep sleep are one of the key features over here. Then rapid pulse, the person is going to be in a state of shock. And then we have the subnormal temperatures seen. We have the contracted pupils that are sometimes seen in these individuals. The McKeown sign is one of the signs over here. So when we flash light into the pupils, there is a dilatation phenomena which is seen in these individuals, and after that the person has the pinpoint pupils, and that is known as the McKeown's sign. This is one of the sign that is observed that can be evaluated clinically in these patients, and that is again going to mark the stage of narcosis in the individual. So this is very important. More than 12 hours after this particular diagnosis, we have a respiratory depression that is that the person would automatically go into. So to stabilize the airway, to stabilize the breathing, to stabilize the circulation for these individuals is the key point that we have to consider in the management of the acute alcohol poisoning cases. So this is almost going to take almost 12 hours after all of these signs and symptoms have been evaluated and have been seen in the patient. And after the respiratory depression, this is the major cause that can lead to the fatality of these individuals as well. Then we have the after effects of the stages of narcosis that are seen. We have a hangover phenomena that is usually seen in these patients, nausea. If the patient comes out of this stage of narcosis, only then he's going to go through all of these signs and symptoms. There's going to be a severe nausea that he's going to suffer from. Headache is one of the key features, severe headache. Abdominal discomforts, these are some of the complaints that we usually come across, and extreme fatigue is one of the key feature over here. Then obviously we have the severe irritability as well. So these are the withdrawal effects, or these are the after effects seen after the person. If the person comes out of the stage of necrosis alive, and he basically is now moving on, but he would be still suffering from all of this nausea, headache, vomiting, and abdominal discomfort and extreme irritability, as observed in these individuals. The fatal dose for the alcohol, the dose which is required to cause the deaths of individuals, is almost making a percentage in the blood levels of almost 350 milligrams percent, or even above than that. Then only it can cause the death of these individuals. Then we have the fatal period, and it is almost 12 to 24 hours. But if the levels reach to this particular criteria, 350 milligrams, then after that it may even take almost 5 to 6 days to cause death in these individuals. So it's again a period that can range from 1 day, and it can even prolong to almost 5 to 6 days after taking, or after having these percentages in the blood risen up to this particular level. Now, we are not always concerned with the acute cases of the alcohol poisoning. Sometimes we have these chronic cases of alcohol poisoning, and we have the people who have been addicted to these kind of drugs, but still they have these particular signs and symptoms. They have these particular clinical features that are developing over time, and that can obviously result in the death or of the individual, because as we all know, almost 90% of the alcohol is metabolized in the liver. So the most affected organ would be the liver, and the liver failure can be one of the cause over here, which leads to death in the chronic alcohol poisoning. So alcohol addiction is the major cause over here, which is going to lead to the chronic alcohol poisoning. Physical deterioration is one of the key factors. Then we have a moral deterioration, and then finally we have a mental deterioration. As we all know, dealing with drug addicts, we usually observe with all of these features. Physically, morally, and mentally, they are deteriorated whatsoever the drug is. So drug addictions usually result in this kind of deterioration, and that is why drug abuse and dealing with patients of drug abuse is very important, because we have the deterioration not only at the physical level, it is even going to deteriorate the individual morally as well, and that is going to result in a lot of crimes. So to stop that demoralization, to stop that deterioration at the moral level, it is very important to educate the individuals regarding this fact. So again, we have the physical deterioration that can be seen as a lack of personal hygiene is one of the factor, and it is going to decrease the immunity. It is going to result in a lot of infectious states in the individual. Loss of appetite is one of the key factor over here, and is again going to result in loss of weight, in the immunity that is decreased in these individuals. Then we have chronic gastritis that is also seen. And then particularly we have impotence is one of the feature that is seen in patients who are suffering from chronic alcohol poisoning. Morally, these patients would also be deteriorated, and that basically results in a lot of rage as we just considered the fact that the most important stage over here is the stage of incoordination in which the person is going to commit a lot of crimes. Uh, Anger is one of the feature over here, rage is one of the feature over here, and the sense of elation, the delusions of grandiosity, there are a lot of sexual assaults that can occur in this stage of incoordination. So, this is a stage which is usually associated with a lot of crimes, and that is basically due to the fact that the person is a drug addict and he's almost morally deteriorated in these situations. Then the person is also going to suffer from mental deterioration as well. So, a lot of things, the incoordination, the imbalance, it is going to enter the blood, it is going to pass on the blood brain barrier, it is going to affect the cerebellum, it is going to affect the overall personality of the individual as well. So, the mental deterioration, the thinking capacity, the flight of thought and the flight of speech that is observed, that is basically going to highlight that it is also affecting the mental capacity of the individual as well. So, these are the three phases of the chronic alcohol poisoning, whether or not it is resulting in the death of the individual, but it is going to affect the overall personality and the overall quality of life in the individuals. Now, the clinical conditions that can arise with chronic alcohol poisoning as it is affecting the physical state of the individual, we have delirium tremens, that is very important. Delirium is basically the loss of memory. This is one of the key features over here. And then we have the Korsakoff's psychosis. Now, Korsakoff psychosis is marked with a lot of features. There are hallucinations, there are tremors, there are physical signs and symptoms, and then the patient is also in a state of psychosis. So, he would be also needing some antipsychotics, and he's also suffering from all the withdrawal symptoms as well. So this is some of the key features. Then acute hallucinosis is one of the clinical syndrome that can occur even individually in a lot of patients. So these are some of the clinical conditions that occur with the chronic alcohol poisoning. We should be well versed with these conditions. Usually you come across these patients in the outpatient departments as well, and a lot of basically a very clear examination, taking the history in detail, taking the corroborative history from the relatives and from the friends is basically going to highlight a lot of factors in these particular cases. Then obviously we have the delirium tremens that is characterized by particular features that are affecting the memory of the individual. It can be an anterograde memory loss, or even it can be a retrograde memory loss that is seen in these individuals. So the physical signs and symptoms are going to be present, and it is also going to affect the memory of the individuals as well. The causative factors would be an unusual thinking. Withdrawal of alcohol is going to initiate this delirium tremens in the individuals. Acute infections take place in these particular cases, shock from injury, and then upon exposure to cold, these patients would elicit all of these signs and symptoms of delirium tremens. So these are basically the particular clinical picture as seen in patients of delirium tremens. Now, the signs and symptoms would include the excitement, as would be observed when you clinically examine the individuals. There would be a fear, marked tremors, hallucinations, and violent behavior. So basically, the thought process is also affected, and there are physical features as well. Hallucinations can be tactile, they can be auditory, and they can be visual as well in these particular patients. Then we have the treatment of delirium tremens, in which we give glucose. We also administer glucose, and along with that, we basically withdraw the cerebrospinal fluid for sampling phenomena. And then we also prescribe chlorpromazine, almost 100 milligrams. So this is the usual prescription that will be given to such patients in a state of acute delirium tremens in cases of chronic alcohol poisoning. And as we all know, the person can also suffer from a lot of acute infections. So we'd be giving antibiotics either prophylactically, or either if he's diagnosed with a particular kind of an infection, we can give the antibiotics, particularly in this case. Then we have the Korsakoff's psychosis, particularly we have hallucinations, we have disorientation, that is one of the key feature over here. Then we have multiple neuritis. So this is again one of the diagnoses over here. The person can have multiple neuritis in this particular case. Amnesia, as we all know, it is marked with this particular loss of memory. It can be either a retrograde amnesia or either it can be an anterograde amnesia, as we see in cases of Korsakoff's psychosis. Managing and diagnosing these cases of Korsakoff's psychosis when they come up to you in the emergency states, you should know how to manage these cases, what are the antidotes that are administered in these particular cases of chronic alcohol poisoning. So then we have the acute hallucinosis. The person can also suffer from a lot of hallucinations. So it can even be the auditory hallucinations. The person can suffer from visual hallucinations and even from the tactile hallucinations. Whatever the case is, there are a lot of crimes. It is usually the stage is associated with anger and rage. And due to this loss of temperament, that can basically result in a lot of scenarios of crimes. So this is one of the situations that we have to consider over here. The symptoms of acute hallucinosis would be suicidal. So it can be one of the clinical picture. The medico-legal aspects can also include the homicidal cases as well. So we have to consider whether the person was suffering from hallucinations due to the intake of alcohol, due to the consumption of alcohol, or was there any other diagnosis that could be made. A lot of people who are suffering from schizophrenia, it can be a multiple picture. It can be a case of psychosis, consuming alcohol. It can be a case of schizophrenia, consuming alcohol. So basically, having the history in detail would be very important. Any recent past history of hospitalization is going to highlight the case if the person has any previous diagnosis as well. Now, alcohol detoxification. When we get these cases, how do we treat them? What is the exact management that we're going to take for these particular cases? First of all, we can administer disulfiram. It's almost given in an amount of 0.5 grams or once daily. Then there is a treatment which is done with temposil, almost 50 milligrams once daily it is given. Now, the clinical examination of the alcohol detoxification is again very important. The clothes are examined in detail, and any stains and any signs and even the smell of the clothes is noted down. The tongue is also seen for any signs of fungal infections because the immunity is quite low in such patients. The speech is usually slurred in these individuals. The eyes are examined for any presence of McKeown's sign or pinpoint pupils, which are one of the key features over here in cases of alcohol poisoning or in cases of acute alcohol poisoning over here. And then we also check for the memory loss. We also check for the signs of amnesia in the individuals. We basically ask the patient or show the patient almost 4 to 5 objects, and then we just remove them and ask the patient to repeat what were the objects shown to on that particular area. So this is basically going to show whether he or she is suffering from some sort of disorientation or loss of memory or not. This is basically how you check the anterograde amnesia. And then you ask the patient for any past or recent events, and if he or she suffers from the loss of memory or he cannot even recall the recent incidents, then we can say that the person is suffering from retrograde amnesia. So mentioning and clinically examining these patients is very important because this is how you're going to start off with the detoxification therapy. Whether he or she needs this therapy or not is going to rely upon the factors over here. Now, the sample collection is again very important. First of all, we have to collect the blood samples because the percentages of the alcohol in the blood is going to result in the specific stages in the individuals. And even the stage of narcosis is marked, and the fatal doses and the fatal periods, there are no particular fatal doses. It's basically the percentage of the alcohol in the blood. When it reaches almost 350 grams, it is going to basically mark the fatality of the individual. So sending the blood samples for the histopathology is very important over here. We are even going to send the urine samples almost, and then bile samples. We can take the CSF samples over here, and breath is also basically noted down for any exhalation amount of alcohol in the individual. So these are the trace amounts that can be detected in all of these samples, in all of these biological samples. Specifically, the vitreous fluid is also inculcated over here. So in this particular lecture, we just summarized a very important group of poisons known as inebriant poisons, how it is going to enter the blood-brain barrier and have these specific effects. Obviously, we must know how to deal with an acute alcohol poisoning, and on the other hand, we must know how to diagnose the cases of chronic alcohol poisoning, because a lot of moral deterioration has taken place due to this chronic alcohol consumption. So to stop the crime, to minimize the crime, the detection is very important over here at this stage, and we must know how to manage and detoxify alcohol in such patients. So that is the end of this lecture. Thank you for watching sqadia.com.